So I'm just got a few slides here just to introduce ourselves about what HIFA projects are. How do they work? What are the benefits and how you can engage with them? Next slide. They are, we think, a unique approach to develop a shared understanding of a priority global health issue, particularly an issue that has a relevance to the HIFA remit. So they leverage the HIFA membership, which is now 20,000 members in 180 countries, through discussion in 4 languages. And we have forums in English, French, Portuguese, and Spanish. The interaction is asynchronous. And so this allows people to reflect on what they write, and this adds to the quality of the input. And several of the discussions from HIFA projects have been published in peer-reviewed journals, and we'll see examples of those later. The sponsors of projects have an option to combine this with a live event, such as a webinar or a conference presentation. And we have found that HIFA discussions do work very well when they are leading into a live event, such as a webinar or a conference. Next slide. We have 3 types of HIFA projects. The type that we have most experience with is we call topic-based, and we've been running these kinds of projects since 2010. And an example of this is the series of discussions we are doing on substance use disorders with NextGenU, which we'll hear about in this webinar. In the last few years, we've embarked on what we call research-based projects. And these are projects whereby HIFA has been integrated into a project proposal even before the funding stage, so that there's a budget line for HIFA as part of a larger research project. And we now have quite a bit of experience in this, thanks to our links with Norway, Ghana, Uganda, and Kenya. And we'll be hearing about this today from Claire Glenton later. And a new type of project we are introducing is we call WHO based. Now, many of you will be aware that we are working in official relations with WHO, and at the next WHO executive board meeting in early February, we are anticipating a renewal of our official relations status, and we have already agreed a collaboration plan 2025 to 2027. And in fact, our next meeting in March will be all about this, and we'll give you more details. Enoch will say a little bit more about this later. Next slide. So how do they work? Well, the sponsor proposes a project and the expected or desired outcomes. We work together to develop the project and secure funding. Then once it's confirmed, we convene a project working group, which typically consists of a number of experts in the theme of the project, perhaps representatives of the sponsor, together with volunteers from the HIFA membership. And this project working group implements the project, which is based around 1 or more thematic discussions, each of which typically last about 5 weeks. And towards the end of the project, HIFA disseminates the findings in different ways, and we evaluate to see where we can learn and improve for the next time. Next slide. The benefits are many, and their benefits are to all of us. It's what you could call a win-win-win, because there's benefits to the supporting organisation stroke sponsor. There's benefits to HIFA members, And importantly, there's important benefits to HIFA.org as an organization. The income that we get from our HIFA projects accounts for more than 2/3 of our total income. So you can see how important it is for us to secure new projects which will help keep HIFA and indeed our collaboration plan with WHO going.